Greetings from UNICEF. I'm Stefan Peterson, Chief of Health. We've just about finalized UNICEF Health's 2017 report, and I plan to provide you a quick overview in the next 10 minutes or so. Worldwide, the commitment to child survival has resulted in exciting progress. Between 2010 and 2016, we saved almost 50 million children's lives. Despite this commendable global progress, child mortality remains unacceptably high. 5.6 million children still die every year, and of that, neonatal mortality accounts for the larger share, 2.6 million. In addition, an estimated 2.6 million children die stillborn every year. Adolescent health concerns are increasingly prominent today across countries at all income levels. Suicide, complications during pregnancy and childbirth are the two leading causes of death in adolescent girls aged 15 to 19. Adolescent mental health, risk factors associated with non-communicable diseases and injuries are growing epidemiological concerns for child health and well-being. Children from the poorest households are at the highest risk of dying. A UNICEF analysis of child mortality from 99 countries reveals that children in the poorest households are considerably lagging behind in achieving the SDG targets compared to the children from the richest households in the same country. 3/4 of the richest on target and 1/4 of the poorest. So achieving the SDG targets will actually require significant acceleration, and this is confirmed by our 2017 analysis narrowing the gaps. And we actually can show that it's actually good value for money to actually address equity. We get twice as much lives saved among the poorest as we do among the least poor. Finally, and what's made progress difficult over the last 4 years and in 2017 is humanitarian and public health emergencies, fragility, conflict, displacement, which have threatened children's rights, stretched health system, and exacerbated inequities in health outcomes. Our strategic plan now for 2014 to 17 that we report on now was developed to help country programs identify and tackle inequities. For health, the strategic plan outcome was improved and equitable use of high-impact maternal and child health interventions from pregnancy to adolescence and the promotion of healthy behaviors. The reporting on this planned outcome would be ensured through interventions to support children, mothers and their families, interventions to improve commitment and capacity at national level, and global and regional momentum to support this delivery. In relation to the above, I'll share some of the major results achieved across the 3 program areas in the next 3 slides, namely maternal and newborn health, child health, and immunization. UNICEF sharpened its focus on programming to reduce neonatal mortality, and to give you an idea of the reach of UNICEF-supported programs. In 2017, UNICEF support enabled 25 million live births in healthcare facilities supported by UNICEF. UNICEF programs contributed to many countries improving access to skilled birth attendants and women accessing 4 antenatal care visits. And an additional 10 countries were validated for eliminating maternal and newborn tetanus, which saved an estimated 81,000 newborn deaths. UNICEF support led to some 15 additional countries reporting 100% basic emergency obstetric services functional around the clock the full week. And the advances in eliminating maternal and newborn tetanus were possible as 21 million women of reproductive age actually received 2 doses of tetanus toxoid vaccine. Supporting these results on the ground, UNICEF at policy level contributed to the development of national plans to reduce neonatal mortality, stillbirth, developing MNCH communication plans, and an increased number of governments actually allocated budgets to reduce adolescent pregnancy. Finally, at global level, UNICEF helped roll out progress monitoring in 75 countries on the operationalization of the global Every Newborn Action Plan, And additionally, UNICEF supported the launch of Quality, Dignity, Equity Network in the 9 first-wave countries in 2017 to ensure that women receive good quality care through pregnancy, childbirth, and the postnatal period. So these are some, but not all of the results that UNICEF and partners deliver. There were many more challenges. Access and insecurity in countries experience humanitarian situation or conflicts. Actually, human capacity constraints, insufficient human resources and staff turnover, insufficient resources, plans may have been developed but not always financed, etc. And I'd like to say that flexible resources, our liquid gold, they were very valuable, but also at the same time a challenge, because that is what allows us to address issues that we couldn't foresee. And the more flexible resources we have, the better we're placed actually to respond to that. In child health, significant progress was made during the period to demonstrate the reach of UNICEF-supported programs. In 2017, over 6 million children suspected with pneumonia received appropriate antibiotics through UNICEF programming. At country level, there was significant progress. 14 additional countries improved care seeking when a child has pneumonia symptoms, and 3 more countries reached a benchmark of 80% receiving oral rehydration salts when having diarrhea. To enable these outcomes, UNICEF trained 240,000 community health workers, and just in 2017 delivered insecticide-treated bed nets to close to 948,000 families. The support from UNICEF ensured that there were fewer stockouts in essential commodities for treatment of malaria, diarrhea, and pneumonia, and improved management of essential commodities in the country. On a more strategic level, there was a shift towards moving from vertical approaches to treating individual diseases to actually ensuring integrated delivery of pneumonia, diarrhea, malaria, HIV, and TB. Additionally, UNICEF rolled out a global care for child development package that includes training community health workers to teach families about the importance of playing with their children in a way that stimulates healthy development. Not all went as planned. There was problems with supply chain that resulted in stockouts. There's growing antimicrobial resistance issues that result in a dilemma of getting antibiotics to those children that most need them, but also ensuring that they're not excessively used. And then there's limited institutionalization of community health workers, and as we know, limited and domestic and fragmented international investments to move forward on these results. From a UNICEF perspective, the very limited flexible resources actually constrained some of our ability to respond to emergencies and supplement child health commodity gaps in priority countries. But on the money we did have, conversely, allowed us to actually work on institutionalizing the community health workforce, and we look forward to doing much more in the coming years with your support. For the last 40 years, UNICEF has been working with governments to ensure that every child is fully immunized as per nationally established schedules. There has been significant global progress, but challenges remain. In 2017, UNICEF-supported immunization programs are now vaccinating more than 60 million children against DPT. Additionally, 153 million have been vaccinated against measles in support of the measles elimination goals in 17 countries, and 18 million children were vaccinated against measles in humanitarian situations. We have only 2 countries remaining that last year had 22 polio cases, compared to 416 cases in 8 countries only 4 years ago. UNICEF also is the largest buyer of vaccines globally. We actually reach 45% of the world with vaccines that are bought by UNICEF. We also provide support on the ground for vaccine introduction, in reaching every child, in ensuring that vaccines are effective by being kept at the right temperatures in the so-called cold chain. Despite the efforts of UNICEF partners, the global coverage of DTP3 has remained at 86%. We see that the main challenges now are reaching the poor children in informal urban settlements and reaching children affected by conflict and insecurity, and finally, and as before, reaching children in remote rural areas. Additional challenges include reaching under-immunized children in countries that are recently ceasing to get the international support when they become middle-income countries. Flexible resources will enable UNICEF to continue providing technical expertise to mobilize domestic resources, including public-private partnerships, to address such issues. Now, UNICEF spent a lot of money in 2017, 1.37 billion to realize children's rights. The health sector continued to hold the largest share of these expenses at 25% of all expenses across the 7 outcome areas. 64%, 2/3 of these 1.37 billion in health came from earmarked non-emergency resources, or so-called other resources regular. As a comparison, though, the health thematic contributions raised in 2017 amounted to about 1% of the overall global health throughput. And these two were mostly earmarked by donors for specific countries. Thus, the global health thematic contributions in 2017 are equal to only 0.1% of the total throughput. And of this, another 0.1%, UNICEF allocates 78% of these resources to underfunded health priorities at country level. And these 0.1% for us left to actually fill unfilled gaps through flexible funding has been too little and too precious. This chart shows the distribution of the 1.37 billion across our health program areas. Additionally, the top 20 countries accounted for 2/3 of all health spending in 2017, and 5 of these top 20 countries actually made up nearly half the total health spending. Thus, half of the 1.37 billion was spent in Nigeria, DRC, Afghanistan, Pakistan, and Somalia. Finally, this map shows the 900 plus UNICEF national and international staff working in health, including those working with supply chains, communications, and management specializations. As you can see, 2/3 of these are based in sub-Saharan Africa and South Asia to accelerate progress on child survival in the highest burden countries. Since 2013, when the last strategic plan was written, a lot has changed. Besides prolonged crisis and conflict resulting in human suffering and displacement, we've had a surge of public health emergencies, including Ebola, that crippled health systems in Africa. We now have sustainable development goals that outline a long-term development horizon as part of SDG 3 for health and well-being, which establishes universal health coverage as the means to achieve this. The Secretary General launched the Every Woman, Every Child strategy that established a focus on the health and well-being of children, adolescents, and women. Towards ending preventable deaths and promoting health and development of children and adolescents, UNICEF now develops its health strategy 2016 to 2030, which you see on this slide. There are 3 high-level program approaches which I'd like to outline. One is addressing inequities in health outcomes. The second one is strengthening health systems, including building resilience rather than tackling individual diseases. And the third one is promoting integrated multi-sectoral policy approaches and programs. UNICEF's actions to advocate child rights, influencing government policies, strengthening service delivery, and empowering communities will be guided by these approaches under the new strategic plan. In the 2018 to 21 strategic plan, UNICEF now wants to accelerate child survival with the help of partners at all levels. We want to ensure that pregnant women, especially adolescent girls, have access to the full package of maternal and newborn health services. That children have access to preventive, promotive, and curative services that are integrated, not only for diseases, but also include developmental and disability services. We also want to reach the unreached and the under-immunized. We want to eradicate polio, eliminate maternal and newborn tetanus, and make progress on measles and rubella. And finally, we support countries to develop adolescent health programs for girls and boys that address adolescent pregnancies, mental health issues, non-communicable diseases, human papillomavirus, and more. We believe that results can only be sustainable if we invest in frontline platforms. This would mean quality primary health care. It would mean community health care that is institutionalized as part of the formal health system, and schools that are part of the multi-sectoral approach to achieving health and development outcomes. Interventions need to be integrated, and these platforms need to be strengthened for results, sustainability, and also to achieve value for money. Flexible funds complementing vertical global resources can help do that. And to achieve all of this, we would further develop our work to ensure that plans, partnerships, and investments reach the most marginalized, that there's corrective action and accountability embedded in subnational management processes, that we harness digital technologies and implementation research, we enable real-time monitoring and learning. Obviously, vaccines, drugs, and supplies need to reach the last mile and the last child, and social protection mechanisms need to be designed in an equitable fashion. Health systems need to be resilient and prepared for emergencies. We estimate that to do all this, we will need about 5.1 billion non-emergency funding until 2021 to deliver this program. We estimate that 1 billion will come from UNICEF core resources that are earmarked mainly for high-burden countries. And from our resource partners, we have two specific asks. We need global thematic funding. We want to increase the 0.1% global thematic to 0.5%. This will provide us $50 million a year to leverage and complement earmarked resources, invest in the health system, develop new programs for child and adolescent health and well-being, and provide technical assistance from global and regional level to ensure that the program effectiveness, efficiency is achieved. Our second ask is support for integration, for multi-sectoral approaches and system strengthening in vertical funding to maximize the sustainability of results and value for money. So as you support something vertically, make sure that it provides support for the larger system. We in UNICEF would like to express our deep appreciation to all of our resource partners who contribute to this work to fulfill the rights of all children, to survive, develop and reach their full potential. Regular resources and thematic funding, and most importantly, the too precious global thematic money provides for greater flexibility, longer-term planning, and sustainability of programs. These voluntary contributions reflect the trust that you, our resource partners, have in our ability as UNICEF to deliver quality support to children and families under all circumstances, and have made it possible all the results that you can read in this report. We'd like to give special thanks to the governments of Sweden and Denmark for their generous contributions and partnerships, as well as to the national committees for UNICEF, particularly the German one, the Korean one, and the Dutch one, for their consistent support to children's health. UNICEF will continue to explore new ways of enhancing visibility for partners who provide global thematic funding, and we look forward to working with you on making this new approach fit for purpose.